Thank you. All right, this is Health and Welfare. We are back live with Jen Carby, looking at H190 and committee. We've been through the bill, and it's one of these areas of, I think, sort of flat out decision making about expanding residency or changing residency to allow for folks to use the Vermont program for end of life choices. Patient choice at end of life changed many times, or not. So thank you. There's David is here. Carrie is here. Welcome.
Thank you.
I
I don't know where he went. I could find him, but that means I would have to leave.
No,
I won't leave.
So, committee, I would look for both discussion and or a motion.
I would move the favorable concurrence with the House, or whatever the motion is supposed to be, concurrence with the H190 with the House
As
bill.
proposed.
There was,
That
was
sounds great.
that thing.
Act favorably.
Act favorably
Yeah,
to
absolutely.
concur with the House
Okay.
position on H190.
And we got a second. Okay, so discussion, and Senator Williams, you're here, so you can offer discussion as well. Thank you. Discussion committee?
I'm texting to
Yeah,
Senator
please
Weeks.
do. We'll just,
Do you just want to, Jennifer Carby, Legislative Counsel, I do just want to mention before you both fill out, I know there has been some assertion by certain witnesses that the existing law is unconstitutional. I think that is a perspective that has not been a legal determination. So I think there are arguments for and against constitutionality, but I would not say it is per se unconstitutional as
it
written.
hasn't yet been
It's not been,
adjudicated
right,
because
it's not been adjudicated, it's been settled and,
outside,
right, settled outside of,
but it was brought to the court.
was brought to the court.
Okay. All right. And so can you briefly review for us what this will do within the context of the broader end of life choices program? So, you know, just a quick overview of how the program works.
Sure. Under our existing law, there is a sequence of steps that the physician who prescribes medication to a patient with a terminal condition to be self-administered to hasten their own death. There's a series of steps that the physician must document occurred. And one of those is that they verify that the patient was a Vermont resident, because that is the current requirement. This would eliminate that requirement that the patient be a Vermont resident. The patient would still need to be 18 years of age or older, under the care of a physician, have a terminal condition, make at least 2 oral requests and a written request for medication to be self-administered to hasten their own death, and then the other series of steps the physician has to document. So this is removing one piece of that.
Okay. Senator Weeks, a motion has been made and seconded to approve H190 as it came from the House and send it favorably to the full Senate for vote. And this is the end of life choices change, allowing for someone from out of state to use the program. And we're in this discussion mode. Jen just was giving us the kind of the overview that it was taken to the Vermont Supreme Court, but
It was taken
it
taken to
Superior-
Vermont, right? There was a
was it
lawsuit
Superior?
filed, actually, I think in U.S. District Court.
Is it Superior
Is
Court?
it U.S. District Court? It's U.S. District Court, so federal court
Federal
for
Court.
the District of Vermont. That litigation has been settled outside of the court, so there has not been a determination by the courts on the constitutionality or unconstitutionality of the existing residency requirement. Separate from that determination, this legislation would remove Vermont's residency requirement.
Is there other precedent that can be cited for a similar concept?
Not a similar fact pattern, I don't believe. I mean, there was similar litigation brought in Oregon. That case was settled There's litigation brought in Vermont, and that particular case was settled, but leaves open, if you don't make this change, there is the potential for additional litigation and potentially a court decision.
No,
That
so
could
no precedent at all
residency
Honestly,
requirement
yeah,
for
yeah.
patient choice at end of life.
about. Well, well, again, that's pretty specific, but, something that has a parallel to this, or at least, it's a similar residency issue.
Is there any other healthcare is there any other healthcare for which a patient cannot cross state lines to seek care? I see David, you're shaking your head no.
Well, we used to have a requirement to use Vermont's marijuana for symptom relief. You had to be a Vermont resident. That provision is no longer, most of that program has been kind of subsumed in the larger cannabis regulation. So currently I'm not aware of other healthcare for which there is a residency requirement, but this is also, a bit of a unique type of healthcare. So I think there are arguments to be made that the state is within its right to require residency, but that's a different question from whether you as the policymakers want to continue that requirement.
Go ahead.
So I could either probably vote poorly now or take the evening to kind of get my head around the issue and participate in a more informed vote tomorrow. That's, unless there's this is on a fast track, something that I don't recognize.
Well,
One day,
What
well,
is
it sounds
your
like we're heading to a
concern?
vote.
I mean, what is your concern about not being able to vote, or that's preventing you from being able to vote right
I
now?
just want to get my head around the whole residency issue. Whether residency in healthcare is germane or not germane.
well, I think we've heard from the Department of Health, representing the administration, that this fits within the administration's support. And we have talked about it as an issue previously. I'm less inclined to hold the vote off at this point, but I'll listen to my committee.
Well, I think, well, first of all, I'm about to send you the floor reports, which I know I promised you a couple, whenever we took this bill up before, but so if you can read the history of it, but that, we as Americans cross state lines all the time to receive healthcare, especially in a small state. Many of us have to go to Boston or wherever for specialized care, and there's nothing ever that prevents us from doing so, and no law that prevents us from doing so. There may be access issues or affordability issues, but there's no state law that says you can't go to Boston Brigham and Women's to get a special test or whatever.
Boston
Children's for whatever. So I think that having a law that prevents you from being able to access what is crucial healthcare is really egregious. The court hasn't weighed in on it directly, but they could if we kept the law as it is, and in the meantime, people wouldn't have access to healthcare that they desperately
I think
need.
even more compelling, I think the healthcare piece is obviously very compelling. But really most compelling for me is in the case that was settled out of court, it was about family and having family in Vermont. And so I think about all the cross state lines that we have, our adjacency to Massachusetts, to New York, to New Hampshire, and we already have crossing state lines for healthcare. When I think about a family who lives in New York or in Vermont, and with someone who wishes to access Vermont, and most of their family may be living in Vermont, just for me, there's a reassurance there that you can be with your family when you end your life. And for those of us who have been working on this for a while and have seen some very compelling documentaries from real life situations, that it's pretty significant and convincing. So,
All true.
yeah.
And I don't mean to
Says-
muddy the waters about the constitutional issue. I just felt like it had been, the only assertion about constitutionality had been from a witness that it was unconstitutional, and I wasn't comfortable leaving that on the record without
Yes.
saying that it's not been settled.
So all I'm saying is it's a very unique aspect of medical care. And I'd like to have 24 hours to proceed to a vote if that's, I mean, it doesn't- it's not like 222 where you're on fast track. You know, this is something, you know, it requires a little reflection.
If I think I've said this to you before, if that will help you feel comfortable voting yes, then I would be okay with that, Madam Chair.
That's what I want to hear on my committee thing. We have it on our schedule for Thursday.
Well, can I
We can postpone the vote till Thursday if that's the committee's wish. I would put it on for tomorrow, if that's, I will put it on tomorrow. We can find a little bit of time, in the morning.
well, with all due respect to my friend and colleague, who spends the whole day with me, poor guy. A process question, you know, we're both relatively new here, but it does seem as though we did talk about this bill last week. It was posted on the agenda for a possible vote this weekend, and I know you had your hands full with other stuff, but I mean, it's not like this is our first time seeing it, so it just,
I know that, but here we are,
okay.
here we are.
Well, here's my
Doesn't seem to be a
question.
rush.
Here's my question. This is not the first time that you've asked for the 24-hour. So I'm gonna start putting things on 24 hours at a time. Because we are almost at the end and we have a lot of decisions to make and we're not gonna be able to wait 24 hours for every bill. So, you know, and I mean that very seriously. We can't do this every time. I agree with Senator Gulick. It's been on the agenda. We had testimony and some of our responsibilities do that sort of reflection when we're not in committee. So, but I will acknowledge the difficulty of this kind of vote, especially when it's maybe the first time you've really engaged in this particular issue. And we'll put it on for first thing tomorrow after our joint meeting with House Committee on Healthcare, unless I hear differently. A majority saying, no, don't do that, but it's still a motion on the table. And we'll do it as quickly as we can, or quickly. We don't do things quickly in here, I know that. But we'll put it on, I know who we are. We'll put it on at 11 o'clock. Hayden will add it in at that time.
Thank you, ma'am.
Yeah, okay. But you've heard my comments and
Yes, ma'am.
concerns. All right, so thank you. I'm so bad.
And then do we rescind our motion?
The motion is in play, the motion's on the table and we're tabling it for this time and we'll pick it up again tomorrow morning. It's been made and seconded. Thank you. Good.
Okay, can you give this back to Hayden, please? Thank you.
Oh, you're off the hook. Hey. Thank you, Jen. Appreciate your time. All right, so we are, where's Chris? There he is. Why don't you come up? Well, I was gonna say Senator Englander, that would have been.
Not yet.
Not yet.
Not yet.
Madam Chair,
Yes, Senator,
can you hear me okay? I just want to make sure.
yes, I can hear you. Thank you.
Thank you.
Sorry.
So we'll just start in just a minute.
Okay. Got it.
You got everything you need, Senator?
Thank you. Thanks, David.
Okay. So we have Chris Winters has been nominated by the governor for to become commissioner for the Department of Children and Families. And Chris, I think we know you in other capacities within the Secretary of State's office. So I want to welcome you.
Thank you.
And this will serve as your official confirmation hearing.
Okay.
I'm not sure whether everyone knows you, so we're going to introduce ourselves and then have you introduce yourself.
Good morning,
Morning.
Senator Hewitt from Burlington, Chittenden Central.
Good morning, Dave Weeks, representing Rutland County, coming from Buck.
Ginny Lyons, Chittenden Southeast, and behind you,
Morning, Terry Williams, Senator for Rutland County.
Morning.
Hi, Bruce Hardy from Aspen District.
okay.
And for the record, my name is Chris Winters. I'm the newly appointed Commissioner of the Department for Children and Families.
Okay, and we have the, really the honor of having a confirmation hearing with you and then offer our recommendation to the full Senate. So I'm gonna ask one question and then because you and I have met and I know that we're gonna hear from you and I hope others will have questions, but your background may appear to be different from what this appointment it requires. So can you talk a little bit about your fit and match with, as it relates to who you have been recently in state government?
Sure, I'd be happy to do that. Thank you, Senator. And thank you for inviting me here today. And this is my first confirmation hearing, so I don't really know how this goes, but I will do my best. It's a real pleasure to be here as the new Commissioner of the Department for Children and Families. And I do know many of you around the table, but I've spent, as you said, most of my time in other committees in another role, mostly the government operations committees, first as a staff attorney for the Office of Professional Regulation, then the Director of OPR, and then the last 8 years as the Deputy Secretary of State. And I have an occasional visit in here to the healthcare committees in my role as an OPR director, but mostly in GovOps. And I am now starting on week 5 at DCF. And as you all know very well, it's a very large and complicated department with quite a vast array of services that we provide to Vermonters in need, Vermont's children, youth, and families to help them succeed. And right up front, I do want to say thank you to all of you for what you do to help support DCF's mission. I know it's a lot of hard work and a lot of very heavy issues. You were just talking about some very difficult issues. We know that we can't do it without your support. And I know you understand how impactful the work of DCF is and that your decisions here can make a real difference for how we do our work and are able to accomplish our mission. So I think that ties into why I'm at DCF now. So it's a good segue. It's the mission, it's the dedicated people who work in the department, and it's the ability to make a difference for Vermont. As some of you know, after 25 years in the Secretary of State's office, I ran for Secretary of State because that was the only way that I could stay there with my boss retiring. I wanted to keep on serving. I wanted to keep on making a difference for Vermont. And I really loved working there and I wanted to finish my career there. I enjoyed it there because I got to lead a really dedicated and passionate team of people who were making a difference every single day, solving problems for Vermonters. And I worked for a secretary who shared my values and my vision for how state government can really reflect our common collective values and solve our common problems in a way that we can't solve alone and that the free market might not address. I especially enjoyed at the Secretary of State's office breaking down barriers and making government more accessible to people. And so whether that was in voting or business registration or professional licensing, through the years, I really became a firm believer in breaking down unnecessary barriers in accountability of state government through a transparent process. And breaking down the silos between state services, something like the business portal, where you can go to one place and get everything you need as a small business from tax, labor, Secretary of State's office and ACCD. So I really wanted to work on becoming more efficient with taxpayer dollars, doing more with less. We've had a lot of changes in technology that enabled that at the Secretary of State's office. And I really tried hard in my 25 years there to make my small corner of state government transparent and try to restore people's faith in government and in process. And so when I approach my work every day, I like to approach it as though there are 600,000 Vermonters looking over my shoulder as I do go about my daily business. So in my race for Secretary of State, and kind of roundabout way to get to where I am today, when my race for Secretary of State fell just short, I started looking around at different ways that I could continue to make a difference for Vermont. How could I best put my skills, my experience, my skills, the things I'd learned in state government in 25 years to the best use for Vermont? And at the time when I was applying, I thought, DCF commissioner is probably one of the toughest jobs in state government. Now I know it is. I was speculating about it then. But it's also one of the most impactful and worthwhile positions in state government. I received a lot of encouragement to apply, and I received almost an equal amount of discouragement from taking on a job that many said it's too big, it's too controversial, it's too emotionally heavy, it's going to wear you down. The issues are unsolvable. Too many systemic issues and unsolvable problems. And when I was hearing that, that's what really piqued my interest and really got me interested in digging in and finding out what it was all about. And so I started talking to people that I know that work at DCF. I started to talking to other secretaries, other commissioners in this administration. And then I interviewed with the leadership team at DCF. And that's what really sold me. Just such a great team of people who are in state government for the right reasons. They want to make a difference. They're passionate about what they do. I interviewed with the secretary, the deputy secretary, and then the governor, and it really clinched it for me. I thought this is the right fit for me. Even though I don't have a human services background, I can make a difference in this department. We have the experts there. We have all kinds of people who really know what they're doing. So in my heart, I'm driven to serve Vermont and make a difference and solve problems. And what I saw there were really good people aligned doing very important work. And so I'm really grateful that they chose me, that the governor appointed me and has given me this opportunity. And so what I bring to the seat as the new commissioner of DCF and what my vision is for the department, to be perfectly honest, on day 22 as commissioner, my vision for the department and my priorities are still very much a work in progress. First and foremost, I'm doing a lot of listening and a lot of learning. So for 4 weeks straight, it's been trying to get to know the people in the division, to build a rapport, to build trust, to understand all of the moving parts in an agency of over 1,000 people in 6 large divisions. As part of my listening and learning, I'm really looking forward to speaking to each of you about your priorities and what you've seen in DCF and what you see as priorities that I should be focused on. I'm trying to get up to speed just as quickly as possible. And I'll mention, 4 big issues that are in my face every single day that I'm focused on working on right out of the gate has been the high-end system of care for youth, the housing issues, the child care issues, and grants and contracts is a 4th one that's coming to my attention. And I don't need to tell you all this, but the DCF's a huge department with 6 divisions and a variety of critical work. So stepping in from the outside has been both overwhelming and exhilarating in a lot of ways as well. We're responding to difficult issues and crises every single day. It's really is, when people say drinking from the fire hose, this is what we're talking about. It's just a rapid pace of critical decision making every single day. And even with now 4 weeks under my belt, it's still going to take me more time to really understand all of the issues and the systems and the culture of the organization, and to identify the strengths and weaknesses and opportunities for change. But I think that's what I can bring to the table. I have some core values and approaches that I've taken in my years of experience in state government, and I'll share with you some of the things that I'm trying to bring to the table at DCF. My values around transparency and encouraging trust, empathy, humility, communication, and collaboration and efficiency in state government. And that's not always easy, but it's something I strive for every day in my work. I also think it's critically important that we pay attention to the dedicated staff there at DCF. They've been through a lot in these last 3 years. There's a lot of compassion fatigue, there's burnout. I really want to make sure we pay attention to them and keep fostering a positive culture and good morale in the agency so that we have the ability to recruit good people. A lot of people work there because they want to work at DCF. They want to do that kind of work. And we have to make sure that they still want to do that work. Retaining good people and the health of the department as a whole enables us to serve Vermonters better. I also plan to build on our successes and look for areas of improvement. I want a culture where it's okay to challenge the status quo, to ask new questions. I'm asking a ton of new questions that probably haven't been asked in a while. And everybody's been great and very responsive to that. I think we can rethink how we approach our systems, our policies, our processes, and our priorities there at DCF. I also very much want to make sure that we continue a culture of empathy and respect toward the people that we serve, that we maintain really strong relationships with our community partners. I found out very quickly how many community partners DCF has and how we can't succeed without them. And our work is only as good as our cooperation and our collaboration with all of those community partners doing that great work. I'm really excited for a few months down the road when I've gotten my feet wet, I've got my feet under me to look for some areas of improvement in our systems. I think that's been something that I've done quite a bit of in the Secretary of State's office, albeit on a much smaller scale. But I want to make sure our systems are efficient, that our services are really accessible to the people that we serve, and our teams can be at their absolute best. And the last thing I'd like to mention that I've heard many times already within DCF is that we really need to get out of crisis mode and get back to more thoughtful and strategic approaches. And that's easier said than done, but the team at DCF is really tired and burned out and responding to crisis after crisis after crisis for the last 3 years. I'm hopeful that we can get out of crisis mode, try to get more upstream with the people that we serve and do the proactive and preventative things so that we can help them before they get into crisis mode. I really love this kind of proactive thinking, and I'm really looking forward to facilitating the department moving in that direction. So hopefully that gives you some sense of what I'm bringing to the table. Even though I don't have the traditional human services background, I'm very lucky to be surrounded with an amazing leadership team and a number of experts I can rely on. And once again, I just want to thank you for all the work that you do to support us at DCF and empower us to be successful in our mission. I'm looking forward to working with the committee and the legislature. And I want you all to know that you can reach out to me at any time. My door is always open to you. And so I'm happy to answer any questions that you might have.
Okay, questions? Thank you, Chris.
Oh,
no.
I was
No, you
trying to be
won.
polite. No, I was trying to be
I'm
polite.
trying to be polite too, because I'm usually the one with the questions. You go first, Senator.
So first off, thank you for your service to the state. You have extensive government experience,
Thank you.
and that's very helpful in whatever agency you happen to find yourself nominated for. This one appears to be a good fit. So I always take the perspective of, are you going to take care of problems or symptoms? And my question to you is, what problem do you perceive your department could address? And what are those priority problems that you intend to start evaluating and thinking through?
So I mentioned a few of them. The high-end system of care for justice-involved youth. Kind of been spinning our wheels somewhat on that. And I'm not laying blame on anyone for that. Just a variety of circumstances have led us there. It's, again, another crisis that we need to deal with. The kids in the system are not being treated appropriately. We need to take a longer-term strategic view on the continuum of care. I'm still very much coming up to speed on a number of those issues. We're following closely what you're doing with childcare here in the building, and appreciate your efforts there. Housing, the hotel and motel program is coming to an end soon. We need to think longer term about housing. There are so many efforts focused around housing, but we still have a gap. There will be a number of people on the streets come June 1st, come July 1st, as the hotel and motel program ends, and we're working hard there to transition as many of those folks as possible into different areas, into shelters, into medical care. So that's been a focus for the last month for me as well. And then grants and contracts is something that I mentioned just because we're a pass-through for a lot of funding, and that needs to happen in a timely way. And so there's a problem there that we can solve in process and processing and solutions, not just focusing on the symptoms of the later delayed payments. So there's some real process management that we can do there. There are 50 other things that have come to my attention in the last month. Those are a few of the top priorities. There's quite a bit in family services and economic services, a lot of opportunities in the Office of Economic Opportunity for us to do things differently, especially around housing. A lot of federal money coming in around weatherization programs that can make a real difference there. So we need to turn our focus to that. So those are just a few things, Senator. It's a long list.
Thank you. Appreciate it.
Thanks, Madam Chair. Well, this is a huge task you've taken on, and I am concerned that you don't have the background. I also know that you are an incredible manager, and I remember hearing this story about some picnic that the Secretary of State's office did, and you organized a Olympics and ran around and made sure everybody participated in the Olympics and got medals. And I can just picture it in my head, you doing that. So I think that speaks volumes to your ability to, or your desire to really make sure everybody feels included and that you literally are all on the same team and that everybody wins. So I appreciate that about you. And I'm still concerned that you don't have the background in the sort of field of human services, and that you have a lot to learn, but it sounds like you already know that. We in S56 proposed a reorganization of the Department of Children's and Families and really kind of divided it up between DCF and a new Department of Economic Empowerment. And I thought it was a great idea. Got pulled from the bill down the hall in the Appropriations Committee. And I was told that the department came in and said, you know, we have too much on our plate right now to reorganize. And that's both fair and ironic because what we were trying to do was take more off your plate. So I'm curious about, I know you're brand new, 22 days is not long, but I'm sure you've already thought about this a little bit. Like, how can you find time to do that important work? Because reorganization and getting things off your plate is really important for the issues that you're trying to tackle and for the people who work for you.
Yeah, I appreciate the question, Senator. First, I just want to say they were called the Olympic Games.
Yeah.
I was the master of ceremonies. We gave out medals. We had events that were, you know, things like carrying a cup full of coffee without spilling it, throwing paper into the recycling bin. So no, I do.
Like a blast.
I do want to say I think it's really important to have a healthy organization with good morale in order to do the job to the best extent that you can. So I'm really focusing on communication internally so that folks on the front lines and on the ground are hearing from the commissioner's office and that they can get that feedback back up to the commissioner and to the secretary as part of kind of building that trust within the organization. I appreciate the thoughtfulness around the reorganization. I definitely have a sense that the organization is a lot to handle at its current size and structure. And I don't disagree that we ought to be looking at a restructuring of DCF. But I do also appreciate that people have been maxed out, and I know that's intended to relieve some of that pressure, but to do it at this time, I think was going to put an additional amount of pressure. I wanted an opportunity as well. I'm glad, I hope I'm going to get that opportunity to look at this over the summer, and I will definitely pay close attention to what the Senate's recommendations have been around reorganization, and see if we can come back with some recommendations next year and a timeline where we can roll this out in a careful and thoughtful way. But I do think reorganization is something we definitely need to consider.
Great.
Go ahead. I just want to say that as much as I understand you don't have a background in human services, I sometimes think a fresh set of eyes and a fresh perspective is really powerful. So I'm excited to have your set of expertise in that position. And I also just wanted to add that I spent some time this summer with our nominee and our paths crossed multiple times. And I was always impressed with the professionalism, the kindness, the humor, and that you brought to every event and every interaction I had with you. And you worked closely with a friend of mine and were in difficult and stressful moments, again, professional, kind. And I get the sense that you're someone who's not going to let your ego drive your decision making, which I think is really important. I'm learning that in this building, that's very important. So I'm really happy about that. So I just want to say I'm very pleased that I get to vote on this nomination.
Thank you, Senator. I'm glad you're here as well.
Senator Williams, you have a question?
I do.
Go ahead.
First, I want to congratulate you on your statewide service to Vermont, and for your willingness to step up and take on this position. I mentioned your managerial skills, and that's going to be a big part of keeping this organization going. What leadership traits do you have? Because it's going to take more than just managerial skills. It's going to take leader traits too, that you're going to bring to the table.
Yeah, thank you, Senator, for the question. I didn't have any formal leadership training when I was made the director of the Office of Professional Regulation, kind of self-taught in that way, kind of thrown into the fire and figured it out as I went. And then when I became Deputy Secretary of State, I was in charge of 4 divisions, very diverse responsibilities. And now here at DCF, I find myself in another, kind of a similar situation where I don't necessarily know all the subject matter, but I do know, I think I know a thing or two about management and about leadership. I consider myself what you might call a servant leader. So I'm willing to roll up my sleeves and do the work. And I listen very closely to the folks who are actually doing the work on the ground. I've got a legal background, so I kind of understand the statutory background and the mission from that perspective and know my way around the legislature. And I like to lead by example. I think I bring my own traits and values into that, and being a clear communicator, being a very good listener, making difficult decisions when it's necessary. The one bit of leadership training that I do have is I went through the Vermont Leadership Institute, the Snelling Center's Leadership Institute in 2005. And I kind of had to make a decision at that point. Was I going to move up in state government, or was I going to move on and get out of state government? And I decided that I wanted to stay with state government and continue to make a difference and see how far up I could go and make as big of an impact as possible on the state that I love, the state that's given so much to me. So I think I bring a lot of just those core values to the role, and lead by example with some compassion and some humility and some empathy. And I think that's reflected in the people that I work with over the years, and the relationships I've built. And I hope to do that very same thing at DCF.
Good answers. Thank you.
Thank you.
All right. Other questions? Good. Good.
Timing.
Amazing.
Right on time.
Well, we've heard from the committee, and I'm sure we'll be seeing you in here quite a bit and look forward to it.
Thank you.
And please keep us posted as time goes on. I know that you're going to be discovering some issues that we might be able to help and deal with, and we would very much like to be a partner in the process. So you've heard Senator Hardy's question about childcare and the restructuring of DCF. That's probably going to be an ongoing discussion. But so your new look at the department and how it looks is going to be important for us, as will everyone else's who's in the department. And not the least of your challenges is going to be, as you said before, how to take care of the kids who are in justice, the judicial system.
Okay.
Yeah, so, and we get that. Not easy, and a lot of committees are just struggling with it. So it would be helpful to come to some closure on some of those issues.
Can I just make one quick comment?
Sure.
I'm sure you're aware of this, and I see our friend from the BSEA over here, and I just, there are a lot of employees in DCF that have been incredibly stressed, and there are safety issues related to some of their jobs. We just had a social worker killed in Brattleboro, and there was not in the too distant past social worker killed under state service. So
Right.
I'm guessing you're already aware and thinking about this, but the balance of safety for employees and safety for clients is really important. And I hope that you do spend some time focusing on that.
Thank you, Senator. I am very much aware. I spent some time with the Economic Services Division in Brattleboro on Thursday. And was just struck by how torn they are at this point. These are folks who want to help, who want to problem solve, yet they have to be concerned for their own safety. Particularly those who have to go out to the hotels to reach out to clients. So it's very much a focus of ours. We're looking at what happened after the Laura Sobel murder and how safety was improved and the steps that we kind of took to reassure staff. And we're looking very closely at that and lessons learned. And we're there for staff who are kind of grieving and afraid right now. And then we want to take some concrete safety measures. We're paying very close attention to that because it's a very hard job that they do. They shouldn't have to be afraid to go to work. And we're doing whatever we can to help alleviate that for them and make sure they have a safe working environment.
Okay,
Thank you very much.
thank you.
Good to see you all. Thank you.
Thank you, and we'll be having a conversation about your confirmation, and then we'll make our decision and send our full report to the full Senate. Thank you.